If you're over 60 and taking one or more prescription medications, you're not alone. In fact, nearly 9 out of 10 older adults in the United States take at least one prescription drug daily. At the same time, many also take over-the-counter supplements. Whether it's calcium, omega-3, vitamin D, turmeric, or herbal products like ginseng or St. John's wort, these supplements are often seen as natural and safe, so people rarely mention them during doctor visits. But here's the serious problem. Some of these so-called harmless supplements can actually interfere with the very medications your doctor prescribed to protect your health. Recent studies show that nearly 50% of older Americans use dietary supplements alongside prescription drugs without any medical supervision. That silent combination could be putting you at serious risk. Supplements can block the absorption of your medications, amplify their effects dangerously, or even cancel them out completely. These interactions are not theoretical. They are real and happening every day in homes across the country. From reducing the effectiveness of blood pressure medication to increasing the risk of internal bleeding, these interactions can be life-altering and in some cases, life-threatening. In this video, I'll walk you through the most dangerous supplement and prescription drug combinations. These are the exact pairs I've seen in my patients over the years, and unfortunately, they are far more common than you'd think. Let's begin with one of the most widely used supplements in the United States, calcium. Number 1, calcium plus thyroid medications, osteoporosis drugs, or antibiotics. If you're taking calcium supplements every day, you're not alone. Calcium is one of the top-selling supplements in the US, especially for older women who are concerned about bone loss. While calcium does play an important role in maintaining bone density, it also has one serious drawback. It blocks the absorption of several critical medications. One of the most common examples is levothyroxine, a synthetic thyroid hormone prescribed to millions of older adults for underactive thyroid. When calcium is taken within a few hours of levothyroxine, it can bind to the hormone in the stomach and prevent it from being absorbed into your bloodstream. The result? Your thyroid medication may no longer be effective, even if you're taking the correct dose. You might start experiencing symptoms like unexplained fatigue, weight gain, constipation, or depression. Many people assume the medication has stopped working or needs to be increased, when in fact, it's a timing issue with calcium. Another important example involves medications for osteoporosis, such as alendronate, sold under the brand name Fosamax. These medications are already difficult for the body to absorb, and calcium taken too close to them can make them even less effective. That means you could be faithfully taking your medication, yet still losing bone density because the active ingredient is being blocked. Calcium also interferes with certain antibiotics, especially those in the tetracycline and fluoroquinol families. This includes drugs like doxycycline and ciprofloxacin, which are often prescribed for urinary tract infections, pneumonia, and other serious conditions. When taken with calcium, these antibiotics may not work as intended, increasing the risk of treatment failure and antibiotic resistance. So, how do you avoid these dangerous overlaps? It's surprisingly simple, but often overlooked. You need to separate calcium supplements from your prescription drugs by at least 4 hours. That means if you take levothyroxine in the morning, wait until lunch or afternoon to take your calcium. The same rule applies to osteoporosis medications and antibiotics. Also, do not take your medications with milk or calcium-fortified beverages. They may seem harmless, but they contain enough calcium to disrupt drug absorption just like a supplement would. It is always best to speak with your pharmacist or physician about your supplement routine. They can help you schedule your medications in a way that avoids these interactions. Now, if you thought calcium was the only supplement that could interfere with your prescriptions, think again. There's a popular herbal product that many Americans take for mood and stress. But what most people don't know is that it can completely change how your liver processes dozens of medications. That supplement is St. John's Wort, and its risks go far beyond what most labels tell you. Number 2, St. John's Wort plus antidepressants, heart medications, and birth control. St. John's Wort is one of the most popular herbal supplements sold in the United States. Many people take it for mild depression, anxiety, or sleep disturbances. It is often seen as a natural alternative to prescription antidepressants. But behind its gentle image lies a powerful substance that can disrupt how your body processes medication at the cellular level. Let me explain how. Your liver is responsible for breaking down most drugs through specialized enzymes, particularly a family called cytochrome P450. St. John's Wort is a potent inducer of these enzymes, especially one called CYP3A4. What that means is, when you take St. John's Wort, your liver speeds up the breakdown of many medications, flushing them out of your system much faster than normal. This is not just theory. We have real clinical evidence that this happens, and the consequences can be serious. One of the biggest concerns is when St. John's Wort is taken alongside prescription antidepressants. Particularly, SSRIs like sertraline, Zoloft, fluoxetine Prozac, or citalopram Celexa. Combining these drugs increases your risk of a condition known as serotonin syndrome. This is a potentially life-threatening reaction caused by having too much serotonin in your system. Symptoms of serotonin syndrome include confusion, agitation, rapid heartbeat, high blood pressure, muscle rigidity, and even seizures. In older adults, this condition may be mistaken for a stroke or severe infection, delaying proper treatment. Another danger is that St. John's Wort can make your antidepressant less effective by reducing its concentration in your blood. If you are using medication to manage depression or anxiety, the supplement could silently cancel out the treatment, leading to worsening symptoms and emotional instability. The impact doesn't stop with mental health. St. John's Wort can also affect heart medications such as digoxin and certain calcium channel blockers. When these drugs are broken down too quickly, their blood levels drop, which can make them ineffective in controlling your heart rate or blood pressure. That can increase your risk of heart failure or stroke without any clear warning signs. Perhaps the most well-known interaction involves birth control pills. While seniors may not use these medications themselves, many are caretakers for family members or simply unaware of the risks their loved ones face. St. John's Wort can reduce the effectiveness of oral contraceptives, increasing the risk of unplanned pregnancy. This happens because it accelerates the breakdown of estrogen in the liver, making hormone levels too low to prevent ovulation. Now, here's where it gets even more dangerous. The interaction may not show up immediately. People may use St. John's Wort for months without realizing their medications are being undermined every day. That's why it's especially risky in chronic conditions where consistent drug levels are critical, like heart disease, depression, or hormone replacement therapy. Unfortunately, St. John's Wort is widely available without a prescription. In most pharmacies, it's sold right next to the vitamins with very little warning on the label. Many seniors assume that if something is natural and over-the-counter, it must be safe. But as we've seen, its effects on drug metabolism can be stronger than many prescription medications. So what should you do? First, Never combine St. John's wort with any prescription medication unless you've discussed it with your doctor or pharmacist. Second, if you are already taking this supplement, bring it up at your next medical appointment. Most doctors will not know unless you tell them. Finally, always read labels carefully and be cautious with any supplement that claims to alter mood, energy, or hormone balance. These tend to affect metabolic pathways and interact with prescription drugs. We've now looked at how a herbal product can interfere with both your mood and your medication. But the next risk is something you might be swallowing every single morning in the name of heart health. That supplement is fish oil or omega-3, and in certain situations, it could increase your risk of internal bleeding when combined with blood thinners. Let's dive into that next. Number 3, omega-3 fatty acids plus blood thinners, warfarin, aspirin, clopidogrel. Fish oil, or omega-3 fatty acids, has gained a reputation in the United States as a heart-healthy supplement. Many older adults take it daily to reduce inflammation, lower triglycerides, or support cognitive function. In fact, it's one of the most widely used supplements among American seniors. Often purchased in bulk at retail giants like Costco or Walgreens. But here's what most people don't realize. Omega-3 supplements can thin your blood. That might sound like a good thing for preventing heart attacks, but when taken together with prescribed blood thinners, there are several common blood thinners that doctors prescribe to older adults. These include warfarin, also known by the brand name Coumadin, as well as aspirin and clopidogrel, commonly sold as Plavix. Each of these medications is designed to reduce the blood's ability to form clots. That helps prevent strokes, heart attacks, and complications from atrial fibrillation. Now, fish oil also reduces the stickiness of platelets, the tiny cells in your blood that are responsible for clotting. This effect is modest when omega-3 is used alone. However, when you add it on top of warfarin or aspirin, the blood thinning effect can multiply. That can lead to a condition where your blood becomes too thin to clot properly, even after minor injuries. The most serious risk is internal bleeding. This could be a gastrointestinal bleed that shows up as black stools or vomiting blood. Or it could be a hidden bleed in the brain, which may present as confusion, dizziness, or sudden weakness. In older adults, these symptoms are often dismissed as normal aging or side effects of other medications, which delays treatment and increases danger. In clinical practice, I have seen patients on warfarin who started taking fish oil without informing their doctor. When we rechecked their INR, a lab test that measures blood thinning, the results showed they were over-anticoagulated. That means their blood was too thin, and they were one small injury away from a medical emergency. What makes this even trickier is that many over-the-counter omega-3 supplements do not clearly state their dosage or purity. Some capsules contain highly concentrated EPA and DHA, while others are diluted or mixed with other oils. Without standardization, you have no clear idea how much blood-thinning effect you're actually adding to your regimen. Even low-dose aspirin, which many seniors take daily without a prescription, can interact with fish oil. If you take both together for long periods, the cumulative effect can increase your risk of stomach bleeding, especially if you also consume alcohol or use NSAIDs like ibuprofen. So what should you do if you're currently taking fish oil and a blood thinner? The first step is to speak with your healthcare provider. Let them know exactly which supplements you're using and at what dose. You should never start or stop fish oil on your own if you're on Your provider may decide to adjust your prescription dosage, monitor your blood more closely, or recommend a safer alternative. Another option is to obtain omega-3 through food rather than supplements. Eating fatty fish like salmon, sardines, or mackerel twice a week can provide cardiovascular benefits without the same bleeding risks. Food-based omega-3 is absorbed differently and tends to have a milder effect on clotting. One last note, don't assume that because omega-3 is natural, it's risk-free. In the world of medicine, natural does not always mean safe. What matters is how a substance interacts with your body and, more importantly, with your existing medications. Now that we've explored how omega-3 can silently increase bleeding risk when paired with blood thinners, let's turn to another everyday supplement that seems harmless but may increase your chance of kidney stones and heart complications if taken incorrectly. That supplement is vitamin D combined with calcium, and what you need to know may surprise you. Number 4. Vitamin D and calcium plus diuretics or heart medications. For many seniors, taking vitamin D and calcium is a daily habit, almost as automatic as brushing your teeth. After all, we've been told for years that these nutrients help protect against osteoporosis and fractures. While that advice is not wrong, it only tells part of the story. In reality, when vitamin D and calcium are taken alongside certain prescription medications, particularly diuretics and heart drugs, the combination can become risky. The danger lies not in the nutrients themselves, but in how they interact with your kidneys, blood vessels, and electrolyte balance. Let's start with vitamin D. This nutrient helps your body absorb calcium from the food you eat. But when taken in high doses or combined with supplements that already contain calcium, it can push calcium levels in your blood too high, a condition called hypercalcemia. This is where the problem begins. Now consider thiazide diuretics, such as hydrochlorothiazide, which are often prescribed for high blood pressure. These medications reduce the amount of fluid in your body by increasing urine output, but they also have a side effect many patients are not told about. They decrease the amount of calcium excreted by your kidneys. That means more calcium stays in your blood. When you combine a thiazide diuretic with vitamin D and supplemental calcium, your calcium levels can build up to dangerous levels without any clear symptoms at first. Over time, this can lead to kidney stones, calcification of blood vessels, or even kidney failure in severe cases. But that's not the only concern. High levels of calcium in the blood can interfere with the electrical signaling in your heart. This is especially dangerous for people who already have heart disease or take medications that affect heart rhythm, such as digoxin or certain antiarrhythmics. Too much calcium can make the heart overly sensitive, leading to abnormal heart rhythms, chest pain, or even cardiac arrest in rare situations. Many older adults also take loop diuretics like furosemide, which have the opposite effect. Many older adults also take loop diuretics like furosemide, which have the opposite effect. They increase calcium loss. When people try to balance this effect by taking large doses of calcium and vitamin D without medical guidance, they often overshoot, creating instability in calcium levels that can lead to muscle cramps, weakness, or confusion. One of the most misunderstood issues with vitamin D is the assumption that more is better. That is simply not true. While mild vitamin D deficiency is common among older adults, megadose, sometimes more than 5,000 IU per day, is not only unnecessary but can be harmful. The safest approach is to test your blood level of vitamin D and adjust supplementation accordingly under medical supervision. Another overlooked danger is when calcium supplements are taken alongside proton pump inhibitors like omeprazole, which reduce stomach acid. These drugs are commonly prescribed for acid reflux and ulcers. Low stomach acid reduces the absorption of calcium carbonate, one of the most common forms of calcium. Patients may then take higher doses to compensate, not realizing that the form they're taking is not well absorbed. That leads to more unabsorbed calcium in the gut, increasing the risk of constipation and kidney stone formation. So how can seniors protect their bones without increasing their risk for heart or kidney complications? First, get your levels checked. A simple blood test can measure both vitamin D and calcium. You may not need as much as you think. Second, space your supplements wisely. Don't take calcium with your thiazide diuretic or keep at least a 4-hour gap between them. Third, consider food-based sources of these nutrients. Leafy greens, fortified plant milks, and fatty fish can provide steady levels of vitamin D and calcium without the spikes that supplements often cause. Finally, avoid taking more than 600 milligrams of calcium at one time. Your body cannot absorb more than that in a single dose. Splitting your dosage throughout the day is safer and more effective. We've now covered 4 of the most common and most overlooked supplement and medication interactions in older adults. Each one of these combinations may seem harmless at first glance, but over time, they can silently interfere with the medications your doctor prescribed to protect your health. In the final section of this video, I'll bring everything together and give you a practical roadmap for using supplements wisely, safely, and in full coordination with your prescribed treatments. Let's move to the conclusion. As we get older, many of us take both prescription drugs and supplements, but combining them without guidance can be risky. Calcium can block thyroid medication. St. John's wort may cancel out antidepressants. Fish oil can thin your blood too much when taken with aspirin or warfarin. And high-dose vitamin D and calcium may stress your heart and kidneys. These are not rare side effects. They're silent interactions that build up over time and can undo the benefits of your treatment. So here's what to do. Write down every supplement and medication you take. Share the list with your doctor and pharmacist. Separate your calcium from certain drugs. Avoid herbal supplements like St. John's wort unless your doctor approves. And don't assume that natural means safe. Supplements can support your health, but only when used wisely. Stay informed, ask questions, and protect yourself from the interactions most people never see coming. Thanks for watching, and see you soon in the next video. Stay well.